Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me again this afternoon is interpreter Margie Propp, and thank you to Margie for being here to provide your services to make this briefing more accessible. We encourage everyone to visit our website at covid19.lincoln.ne.gov, where you will find a dashboard with the latest demographic and other information about COVID-19. We update that dashboard at about 3 p.m. each day. And you will also find there our COVID-19 risk dial, a color-coded tool that gives residents an understanding of the risk level here in Lincoln and Lancaster County. Last Friday, we moved that dial about the risk of spread of COVID-19 from low orange to mid-orange, indicating that there is a higher risk of the virus spreading in our community. From July 19th through the 25th, 363 cases were reported in Lancaster County. That's the highest weekly total since the pandemic began. The next highest total was the 331 cases from the previous week. We need everyone to understand what a serious situation we are in here locally and to please do their part to prevent the spread of COVID-19. Please join so many other members of our community as we take those common sense steps to take care of one another and prevent the spread of COVID-19. Wear a mask. Watch your distance, keeping at least 6 feet away from others at all times. Wash your hands frequently, and if you are sick, please stay home. These proven public health strategies are vital to our ability to reopen schools safely and to reinvigorate our local businesses and economy. Today in Lincoln, an additional 58 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 2,895. Our total recoveries identified to date are up from 1,088 to 1,145. And with that, I'll hand it over to Interim Health Director Pat Lopez, who is here with an update.
Thank you, Mayor. The directed health measure requiring masks to be worn in publicly accessible buildings within 6 feet of distance when you can't maintain that distance became effective on July 20th. Since then, the health department has received 121 complaints through our uplink, and 105 of those complaints were about lack of compliance with the mask requirements. And of the 105, 43 were regarding eating and drinking establishments ranging from quick shops to restaurants to bars. The health department has reached out to these businesses to provide guidance on how the directed health measure applies to their business. We've suggested approaches to help compliance, and we've offered signage. Since July 20th, the health department has received 203 calls from businesses and residents with questions on the directed health measure compliance or complaints. As the mayor said, the COVID-19 risk dial now indicates a high risk of virus spreading in our community. We introduced the dial on May 11th and began using it as a tool to help the public know the specific steps they can take to protect themselves, their families, and the health of everyone in our community. This is important to us because it is the responsibility of the health department to guide our residents on actions they can take to protect the public health. The dial has become the topic of some discussion in the community, and we are receiving questions about how we determine the dial position. Some are saying that the dial should be in the red right now, indicating a severe risk. Others are saying it should be in green, the lowest risk level. Those models are generally looking at one indicator when you see them, and they fail to consider how our local situation changes from week to week. The health department uses 5 major categories of factors, and each of those has multiple indicators associated with it. As an example, here's what the dial would look like if we just considered one of those factors. If we look at just one measure, such as hospital capacity, we would have been in yellow early on and now in green. If we look just at testing, we would have been in orange early when testing was limited, and we'd now be mostly in yellow or green with testing readily available. If we isolated contact tracing, we would have ranged from green to orange, depending on the range of factors that impact the ability to do timely investigations, such as the delay in receiving testing results. If we only looked at the trajectory of the positivity rate, would have been in the yellow, except for late April and early May, when our rate was much higher due to the outbreak at Smithfield. And if we only use new cases as one measure, then we would be mostly in red because case numbers are on the rise locally. By using multiple measures, looking at our situation locally, and considering how those measures are changing over time, we are able to come up with a data-based description of local risks to the public. Our epidemiology team continually monitors the data and then reviews all the indicators each week to help make recommendations regarding where the level of risk is for Lincoln and Lancaster County. When we announce the dial position every Friday, we are relying on the extensive knowledge of our public health team, which includes staff who have decades of experience in epidemiology, outbreak investigations, and biostatistics. The objective data, the consensus recommendation of the professional team are used to make the recommendation I receive every week. We are adding information to the risk dial that explains the many factors that we take into consideration. Again, you'll find the dial at covid19.lincoln.ne.gov. The decision to move the risk dial from low orange to mid-orange last Friday reflects the situation we have seen over the past 3 weeks. The positivity rate is up from an average weekly rate below 5% in June to 7.2% in July. The average number of new cases was about 120 for the month of June. This has increased to a weekly average of 270 in July, a 125% increase. Since the beginning of July, 77% of the new cases have been in individuals under the age of 40. In talking with the hospitals yesterday, we have yet to see an increase in younger individuals being hospitalized due to COVID-19. The hospital reports 17 COVID-19 patients currently hospitalized, with 9 from Lancaster County and 8 from other communities. A bright spot is that testing is on the increase, from an average of about 2,500 tests each week in June to almost 4,000 tests per week in July. As a reminder, anyone in Lancaster County can be tested. Bryan Health and CHI Health St. Elizabeth both have capacity to do more testing at their drive-through testing sites. To get started, you can fill out a free online risk assessment at chihealth.com or bryanhealth.com. Test Nebraska has expanded its testing to 6 days a week. That process starts at testnebraska.com. You do need to go through these websites to get an appointment for testing. The capacity to do contact tracing remains sufficient at this time. However, as I mentioned earlier, slower turnaround times for test results is delaying the start of the crucial process of contact tracing. This can impact the ability to prevent the development of case clusters or outbreaks. Again, with the risk of the virus spreading remaining high, all of us should be staying home as much as possible to prevent the spread. If you have been tested and are waiting for your results, you are required to quarantine until you get results. This is a crucial factor and must be done to prevent potential exposures in the community that we have been seeing. I also wanted to share that based on our information and our case investigations, 235 of our individuals that we have had contact with were asymptomatic. So that's about 11.25%. This means that of those, 88.75% individuals were symptomatic. Thank you.
Thank you, Director Lopez. This weekend, the temporary closure of 2 downtown bars in the Rail Yard Commons area became necessary to protect public health. In general, however, our business community has worked really well with our health department to implement strategies that will prevent virus transmission. We want to thank all of the owners and managers who are working so well to adhere to the physical distancing requirements. In some cases, we've seen that they have discontinued specific practices, like offering salad bars. In other cases, they have adapted to offer new practices, like the ability to order food and drinks over the phone, so customers no longer need to stand in line in close proximity to one another. We also want to thank all those employers supporting our efforts to ensure that employees who may be sick are excused from the workplace for testing and medical follow-up. This continues to be crucial in stopping the spread of the virus and in keeping businesses open, and it will be especially critical when school is back in session. We've heard LPS emphasize the need for families, students, and school personnel to be diligent in monitoring for symptoms and making sure that those with symptoms stay home and isolate. And that is true for all of us as we work to keep our community safe and prevent potential exposures to the virus. Moving on to just some positive news before we move into Q&A. It was announced last week that the Career Ladder program of Lincoln's New Americans Task Force is one of 5 finalists to receive a grant from the Google.org Impact Challenge in Nebraska. Career Ladder connects skilled immigrants and refugees to careers, digital resources, and professional networks while fostering economic opportunity here in our city and throughout our state. As a finalist, the Career Ladder program has already received $175,000 in funding, and now that the project that gets the most online votes will win an additional $125,000. So we invite everyone watching to please cast a vote for Career Ladder at g.co/Nebraska Challenge. Again, that's g.co/Nebraska.challenge. Votes are limited to 1 per person and must be cast by Thursday, July 30th at midnight. And you can find out more about our Career Ladder project and the New Americans Task Force and a link to vote, once again, this time at the New Americans Task Force website, natf.lincoln.ne.gov. And finally today, this is another Sunshine Tuesday. We are again sharing art from children as part of the Sunshine Kids for Seniors art project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. If you would like to join the thousands of others who have submitted art, please do. Please send your scanned notes and artwork to sunshinekids@lincoln.ne.gov. And then we'd like to open things up for questions.
Hi, Mayor. This is Bill with 1011. Couple questions for Pat today.
All right. Thank you.
Thank you.
Hi, Bill.
Hi, Pat. Thanks for tracking down those symptomatic versus asymptomatic. I just want to double check I have the right numbers. That was 235, correct?
Right, so 11.25% of all our cases have been asymptomatic.
Okay. And just to clarify, for my math, 235 out of 2895 would be 8%.
Oh, I'm sorry, Bill, we're still putting in some other data. So we use the 2,089.
2000. Okay.
Got it?
I do. Thank you. And then just because this is the most common question we get, so I just want some clarification on it. In risk style, it is the health department, it is the psychologist with a lot of experience, but there's no specific mathematical formula that goes into it. Is that correct?
Yes, there are formulas, and Bill, we're going to be talking about that more in depth on Friday and sharing that and posting something on the website so people can look at it. But, there are measures related to the positivity rate, the case numbers, and contact tracing. that we look at in adjusting the metrics. But then there are the other measures we look at too that are more qualitative measures, like what is the availability of our turnaround on testing time, so that we know we can control and mitigate. So we have to take in those other factors that some other measures people might be seeing, some other information that's being put out is out there. So we're using information that shows the whole picture, not just, and we're looking at our case number increase, our positivity rate increase, and applying the metrics. So we'll be sharing more in depth with everyone on Friday.
Okay, thank you so much, Pat.
Uh-huh.
Questions from Channel 8. What caused the shutting down of Longwell Iguanas? And then while looking at establishments this weekend, what were you generally seeing? Were most bars fully complying?
We actually went to several bars. Our environmental health specialists who do food inspections and work with the restaurants and the bars were doing the inspections, and we were looking specifically at how bars were complying with the directed health measures according to the letter that we had hand delivered to them the week before. So what we saw where there were violations were related to not using masking, people more than in larger groups than 8. We saw people standing in large groups together, shoulder to shoulder, out in the area. We may have seen, in some instances, people are supposed to be seated at the table unless they're getting a drink or ordering food. And so those were some of the violations, and they were a little bit different at each location.
Mark at KLAN, question for Director Lopez.
Yes.
On the COVID risk dial, curious, which of the data, the 5 factors, do you use more objective data versus subjective analysis? And is there weighting that goes into those particular areas as you make your decision?
Well, what we've used is looking at the Johns Hopkins metrics that are recommended, and there is specific guidelines, which is what we're going to provide, and I can't really recite that. I'm sorry to say, just right off the top of my head, but it is looking at a scale of where the change has been. So, for example, we look at a trajectory related to the positivity rate and whether that is accelerating or decelerating. But none of the, I think what you're asking is any one measure weighted more than another measure. Is that correct?
That's correct, yes. And especially on the subjective side with your epidemiologists and the rest of your staff.
No, they're all on those subjective sides. All of those things are looked at and weighted the same way.
Pat, I do have one quick follow-up on the asymptomatic versus symptomatic cases, that 11%. What do you think that says about COVID-19 cases here locally? Do you think that dispels any myths at all?
Well, I think if you look just at the sheer number, it's a very small percentages of our cases right now. And I think we have to keep in mind too, at one time we would have said, okay, we only have a limited amount of testing available, so only people with symptoms are getting tested. But now testing is open to anyone who wants to get a test. So I think what we're seeing is primarily most of the individuals that are positive in our community are symptomatic at this point in time, Bill.
Hi, Sophia Sarek with the Journal Star. I was wondering, as more college kids start returning to Lincoln for the fall semester, is there any plan in place how to further prevent the spread in age group 20 to 29?
Yes, we've been working really closely both with the athletic department at the university and with the campus to address how we can mitigate and try and control the spread of the virus and how we can do rapid testing to help mitigate that. We've worked on quarantine and isolation measures, and we're still continuing to follow. There'll be more information coming out.
Okay, thank you.
Mhm.
These are from Channel 7. First, business organization wants to know why more warning or education wasn't given to the establishments before they were shut down.
Well, we have done a great deal of education and work with the establishments. They've been we've shared information with them, we visited with them on the phone, we provided guidance. But when we hand-delivered the information with the directed health measure, that clearly stated what they needed to do.
There were a number of other businesses that people have said weren't following the directed health measure. How will you enforce this fairly?
Well, if we know, we're going to be out doing surveillance. We said that when we delivered that. We've said that the information to the bars. We've said that repeatedly at our press conferences here, and we're going to continue to do surveillance. And we also have people providing reports to us, and we follow up on those.
Why are you going after businesses and not individuals? In terms of enforcement, I guess.
Well, a bar is responsible for what happens in their environment. And so they need to make sure that their patrons are coming in, for example, and following the measures that are there.
And then, are there positive tests outside of the county included in the COVID-19 risk meter?
No.
It's just local data.
Our data is just specific to Lincoln and Lancaster County, to our community. For our health department, each health department has their own set of data that applies to the community they serve.
One more quick one. One of the more common theories going around right now is that, a friend of a friend tested or never got tested, but then got a email saying they tested positive. Is there any evidence of this happening in Lancaster County?
Thanks for asking that, Bill. I was thinking that was going to be one of the last questions I got. Actually, we're hearing that in two different communities. So we, in those communities, one's Grand Island, and I think you also saw the other one was in Douglas County. I've been in contact with both those health directors, and they've asked for anybody to come forward that this has happened to, that got a positive test that wasn't tested. But I also want to tell you that anybody that tests positive, if they live in Lancaster County, we are notified, and we've had no contact with any positive individual that said, I didn't have a test at Test Nebraska. So we're not sure where it's coming from, but that's the latest rumor.
So just to clarify, no evidence of that happening locally that you've seen?
No, not at all. And in the two communities it's supposed to be happening, they haven't found any evidence either. So.
Thank you so much.
Uh-huh.
Are there any other questions? I just wanted to follow up on the question about whether or not things are being enforced fairly. We have every incentive to try to be fair and comprehensive in our enforcement and education efforts because we are trying to protect life and prevent suffering and protect the capacity of our healthcare system. We have no interest in targeting people in an unfair way. That doesn't serve that purpose. But we are, in the effort to be granular and to make sure that when we do see instances where businesses are out of compliance and then following through on the measures as written, we're also sending a signal that we are taking this seriously, and this could happen to you too. We don't want to shut down all the bars in Lincoln, But if we cannot get the kind of compliance we need to keep people safe, that is an option that has been on the table. So I would think that, for businesses out there, they would be looking at that kind of focused approach as one that's really fair and reasonable and intended to try to be working with the public and our business community as much as possible. Any other questions? All right, thank you so much for tuning in. We appreciate you giving your time and attention to these important health messages. Please remember to wear a face mask when you're out in public and around other people. Watch your distance, keeping 6 feet from others, and wash your hands frequently, and stay home if you're sick. We all need to do our best to prevent the spread of COVID-19. Thank you.